Welcome to WEFM'S 3pm News. I am your presenter, Jessica Klein. First on the local scene. Roger Duncan, Medical Officer of Health, MOH, has confirmed the first JN.1 COVID 19 variant in St. Vincent and the Grenadines. On January 26, 2024, he made the announcement on NBC Radio, stating that samples were sent to the Caribbean Public Health Agency CARPHA, which confirmed the presence of the variant. Duncan used the opportunity to remind the public to take precautionary measures, such as staying home when sick and not sending children to school if they are unwell. He explained that the JN.1 variant is a mutation of COVID 19, which first appeared in SVG in 2020. According to the World Health Organization, WHO, JN.1 is a variant of interest, meaning it's a new mutation. Dr. Duncan noted that it is still too early to determine its properties, but the JN.1 variant appears to be more transmissible than previous strains. Duncan has urged those at higher risk, such as the elderly, children, and those with pre-existing conditions, to exercise caution as they may develop more severe symptoms. The Georgetown Marketplace is expected to be rebuilt in this year by the government of St. Vincent and the Grenadines. This is according to Minister of Urban Development, Bernava Brown, who said that the Georgetown Marketplace is where people meet to buy and sell, already established, which means that the government will be providing a safer, healthier environment for people to ply their trades. The market is expected to have butcher stalls and an expansion of space that will allow vendor stalls of up to 30. Brown further stated that the redeveloped market would have an office manager, a cleaning area, and an area for security. She also disclosed that the demolition of the building that currently exists will begin this year, 2024, followed by the start of the market's construction. Still on the local scene, an investigation into the motor vehicular accident that resulted in the death of Maurice Murphy, a 57-year-old resident of Redemption Sharps, and the injury of 43-year-old Kenroy James and Lesroy Irish of the same address has been launched by police officers attached to the Chateaubelair police station. An official release from the RSVGPF states that James sustained injuries to his right hip and mouth, while Irish suffered a fractured left wrist. The incident occurred on Friday, 26th January 2024, around 11:40 a.m., while Murphy was driving along the Tramaca Public Road when he lost control and hit a retaining wall. The driver sustained injuries as a result of the crash and was pronounced dead at the scene by a medical practitioner. Police officers, as well as emergency services, responded to the accident and assisted the injured passengers, who were transmitted to the Milton Cato Memorial Hospital in an ambulance for medical treatment. Irish was treated and discharged on the same day, and James is still a patient at the Mayo Surgical Ward in stable condition. A post-mortem examination is expected to be conducted on the deceased to ascertain the exact cause of death. The RSVGPF has extended its condolences to all who are negatively affected by this tragic incident. The investigation into the matter continues. On the regional scene, the Ministry of Health in St. Lucia has emphasized the importance of early detection and treatment of leprosy, with an increasing number of new cases reported since the beginning of the year. Despite technological advances, the island has experienced a steady rise in cases over the last 9 years. In 2023, St. Lucia registered 11 new cases of leprosy. However, community dermatologist Kotora Edwin Tobias explained that the disease is curable through a combination of drugs which are readily available free of charge within the public health system. Edwin Tobias highlighted that the disease is primarily spread through droplets from the nose and mouth during prolonged close contact with untreated leprosy cases. On average, leprosy has a prolonged incubation of at least 5 years, meaning that someone could be infected and not show any signs for up to 5 years, including body lesions or symptoms such as loss of feeling. The health ministry officials stated that leprosy appears to affect men and persons who live with or have prolonged contact with untreated persons with the disease. In response, the ministry plans to introduce treatment for persons who have had close contact with someone with the disease. The ministry has urged citizens to examine themselves and family members closely, advising people to visit the nearest healthcare facility upon seeing a light colored spot with decreased sensation or feeling, or getting non healing recurrent burns and ulcers to the hands and feet. Early detection and access to proper treatment can prevent disability, according to the community dermatologist. This year, the health ministry hopes to make great strides in the fight against leprosy, and it all begins with recognizing the need for early detection and treatment. Still on the regional scene, Barbadians now have access to genetic testing for eye diseases, marking a significant step forward for the island. Dr. Charles Pearce is the visionary responsible for bringing this testing to Barbados, recognizing the need for more accurate diagnosis of eye diseases among the population. Pearce has over 15 years of experience in the field, having worked in both Barbados and the United Kingdom. Testing for genetic eye disease in Barbados will allow for more accurate understanding of the genetic abnormalities and how prevalent they are across the island. By collecting saliva through a simple swab of the mouth, the genetic testing will enable doctors to provide more definitive diagnosis. People with inherited eye disease can experience night blindness and changes to central vision. Currently, patients with low vision manage their disease through habit changes such as wearing shades, magnification, and enlarging fonts on smart devices. With this new testing, Dr. Pearce hopes to build a library of different genetic abnormalities that exist in the population, leading to further research and improved treatment in the future. Finally, on the international scene, the city of Mexico recently resumed bullfighting after almost 2 years, causing outrage among animal rights activists. Bullfighting has been a tradition in the country since the 16th century, but a judge had suspended the practice indefinitely due to animal cruelty concerns. The Supreme Court reversed this decision last month, but the issues remain contentious. The protesters argue that bullfighting is torture and not a cultural or artistic expression. Demonstrators carrying banners and wearing bull masks gathered near the Plaza de Mexico bull ring, the world's largest bullfighting arena, to voice their opposition. The judges have yet to rule on the case's merits, and supporters and opponents of bullfighting continue their legal battle. But inside the venue, thousands celebrated its return with chants of long live freedom. President Andres Manuel Lopez Obrador has proposed a referendum on the future of bullfighting in Mexico. Global bullfighting statistics and legal status in select countries, according to Humane Society International, shows that approximately 250,000 bulls are killed in bullfighting events worldwide each year. Though the practice is banned in some countries, it remains legal in several areas of Mexico, France, Portugal, Colombia, Venezuela, Peru, and Ecuador. Although bullfighting is legal in Spain, some cities have also prohibited. This has been WEFM'S 3pm news. I have been your presenter, Jessica Klein. Join us again at 5:30 p.m. for WEFM's evening news, and we thank you for listening.